Nutritional considerations. Enteral nutrition. Enteral nutrition is the provision of food or nutrients through the gastrointestinal tract. The most common and least invasive route of administration is oral consumption. The following are considered enteral. So when we say enteral, it goes through the GI tract. Examples are esophagostomy, gastrostomy, jejunostomy, nasoduodenal, nasojejunal, nasogastric, and oral. Food or drug interactions. Food often interacts with oral medication, causing a delay in absorption and thus decreasing the effect of the medication. However, in some instances, such as with the grapefruit, it causes an increase in effect. So remember, certain food or forms of nutrition can interact with certain medications. So that's why it's very important to take note and consider the patient's nutritional status, what are they eating, and also how does the medication work and how is it affected by food in the GI system. Total parenteral nutrition, or TPN, is the intravenous administration of the total nutrient requirements of the patient with gastrointestinal dysfunction, accomplished with a peripheral or central venous catheter. TPN can supply all the calories, carbohydrates, amino acids, fats, trace elements, vitamins, and minerals needed by the patient. So this is what TPN looks like. It's usually in a big bag, and usually on the label it will tell you what's in it and the amount of amino acids, trace elements, vitamins, minerals, and so on. And in addition to TPN, they may also have lipids together with it, and usually is the white milk-like fluid, and not to confuse with propofol, which is another milk-like fluid. TPN goes with lipids. So sometimes it's in a bottle, sometimes it's in a bag. And this is usually connected to a filter. So the TPN goes all the way down, and before it touches the patient, there's usually a filter in between. Just a reminder for future reference, so when you start giving TPN and lipids don't go in with that filter, because then the lipid is not going to go through that filter because it's too large and too thick. So it's just going to cause your IV to clog, and you may just have to restart and get new set of tubings if you end up doing that, which unfortunately I did as a new grad. I set up the TPN and lipids and no one ever told me. So I thought that you just connect them together, and I just applied the IV filter. So when I started the IV pump, it just started beeping and I couldn't troubleshoot. So finally I approached an older nurse, and I basically felt so bad for not knowing, and he just looked at me and is like, well, of course it's not gonna go because you put the lipids in the filter. So just FYI, don't put the filter with the lipids. Anyhow, so TPN bypasses the GI system. So if for some reason the patient is unable to take enteral nutrition, which is what's preferred, what's ideal, then we meet those nutritional needs with TPN. It's not typical for patients with intact GI tract. So usually we try to avoid that, right? Because that's not the ideal source of nutrition. And it's often indicated for patients under GI rest. It's also indicated for patients that are severely malnourished. And it is often administered via a central line, just like this one over here. But when not available, PPN or peripheral TPN can be done temporarily in a peripheral IV. And as I mentioned earlier, when administering TPN, it is also common to also administer fat emulsions or lipids to replenish essential fatty acids and for energy source. Special populations: obstetrics, pregnant, and or breastfeeding. The FDA classifies drugs according to their safety for use during pregnancy. This system of drug classification is based primarily on animal studies, and there's limited human studies. Traditionally, pregnancy categories were being used. So this is the traditional pregnancy category. So category A, B, C, D, and X. X, described as fetal abnormalities, have been reported, and positive evidence of fetal risk in humans is available from animal and or human studies. So these drugs are not to be used at all in pregnant women. Category X. Now, currently, there are new categories as of 2015 which will eventually replace the previous categories. The new requirement includes labeling the medications with pregnancy, lactation, and female and males of reproductive potential. You will most likely see both in the newer drug packaging and the newer drug handbooks, but the textbook and some older drugs will likely still use the traditional categories. Patient with comorbidities. Concurrent disease or other medical conditions can cause patients' response to a drug to vary greatly and alter therapeutic response to a drug. That is why it is very important to obtain a very thorough medical and surgical history, as each comorbidity may affect certain drugs differently. Example, if you don't know that the patient has renal insufficiency and you administer lisinopril, which is known to worsen kidney function, you may end up sending the patient to a full-blown renal failure. There will be medications that are contraindicated to give to patients with certain medical conditions. In addition, stress, depression, and anxiety can also alter therapeutic responses. Overall, you have to really be familiarized and put an effort to obtain a thorough medical history of the patient. So what are the things to consider when you are caring for a pediatric patient? Dosing. Dosing varies depending on the children's age and weight, so it is especially important to take those in consideration. In children, first pass elimination by the liver is reduced because of the immaturity of the liver and reduced levels of microsomal enzymes. Intramuscular absorption is faster and irregular. Protein binding is decreased because of the decreased production of protein by the immature liver, and more drugs enter the brain because of its immature blood-brain barrier. Many variables affect metabolism and reduce renal function, concentrating ability, and excretion of drugs. Children's small bodies and immature organs make them more susceptible to drug interactions, drug toxicity, and unusual drug responses. That's why we have to be very careful. When it comes to injectables, skin is thinner and more permeable, so it's easily permeated. So it allows liquid or gases to pass through it, and skin is more easily penetrated. Also, we need to take in consideration the size of needles and the amount of drugs given when giving intramuscular versus subcutaneous injections. What are the things to consider when caring for a geriatric patient or older adult? Older adult patients consume a greater proportion of prescriptions and over-the-counter medications. They commonly take multiple medications on a daily basis due to their multiple comorbidities and chronic illnesses. Polypharmacy. Polypharmacy is the use of many different drugs concurrently in treating a patient who often has several health problems. This increases the risk for a drug interaction and adverse drug reactions. You will start realizing when you start your clinicals that a lot of your older patients will have about 10 to 15 medications that they take daily. I had a patient one time that used to see another provider, and when he came to the office and saw me, his blood pressure was in the 80s. However, he refused to go to the hospital, so I started him on a medication called Proamatin or Midodrine to increase his blood pressure. To cut the story short, I did my own investigation to find out what was causing his low blood pressure. I called his pharmacy and I also had him bring all the medication that he took to find out that he was on multiple antihypertensive medications and diuretics, and some of them were even duplicated. I had to physically take away the duplicates to avoid a similar incident from happening, and I had him follow up every 3 to 4 days until his blood pressure improved. This is an example of the effect of polypharmacy when it comes to our geriatric patients. Sight and memory. Although not always the case, older adults' vision and memory often gets worse as they age. Therefore, this can be factors for possible adverse drug events. They may forget to take their medications or pick up their prescriptions. They may read the directions incorrectly. It is especially important to assess these to ensure that they are able to safely manage their own medications and take them as ordered. Physiological changes affecting pharmacokinetics. This is Table 3.3 from page 37 of your textbook. It is a summary of different body systems affected by the aging process. Physiologic changes associated with aging affect the action of many drugs. As the body ages, functions of several organ systems slowly declines. In general, absorption is decreased, distribution is decreased, metabolism is decreased, and excretion is decreased, which can lead to a higher risk for adverse drug reaction or drug interactions.